everyone, and welcome to Module 2. This week, our focus will be on the continuous patient care and family medicine, or family practice. So with that being said, this is a pretty heavy week as we have 5 chapters for this week. We're going to have Chapter 35 in its entirety, Chapter 36, pages 795 to 803, Chapter 42, pages 979 to 984, Chapter 48, pages 1141 to 1143, and finally Chapter 57, pages 1347 to 1348. So let's go ahead and get started here, and we're going to start with Chapter 35, which should be a review for everyone as it's discussing vital signs. I know that some of you we're very excited when we started this in fundamentals, so this is just kind of that continuation. Please remember that vital signs are a full responsibility of a medical assistant. Vital signs are able to give the provider a quick snapshot of just how the patient's body is functioning. And with that, there are 6 main vital signs that as medical assistants you are responsible for: weight, height, blood pressure, pulse, temperature, and respirations. All of these should be done at every single visit. I'm not going to go too much further into those, as my hope is that you remember them from when you did take the fundamentals course and the continuous practice that you've had with them. Now, because we are also talking about family medicine, it's important for us to discuss what that means. So family practice physicians treat your entire family regardless of age and gender. In some cases, they'll refer to patients with specific conditions to specialists. So that means that they will see anyone from birth to death. This type of doctor will look at the whole patient, making sure the use of vital signs is correct, and makes the importance of those stand out much more than it does in any other visit. So you really need to make sure that you are confident with your vital sign taking skills. At this point in the course, my hope is that you guys have had good practice and that you feel very confident going out into the field of being able to take vital signs completely. Next chapter we're going to focus on is Chapter 36, which is going to focus on assisting with the physical examinations. This is one of our key responsibilities as a medical assistant. Our roles during this procedure include preparing the exam room, interviewing the patient, and documenting all the medical records. So let's take a closer look at some of those categories. When preparing the exam room, you want to make sure that you dispose of any patient gowns or drapes that were left behind, clean the exam table with the proper disinfectant, and replace the table paper. You'll want to dispose of the equipment used during the previous exam. If it's reusable, make sure that you clean and disinfect it as appropriate. You'll clean all the surfaces of the exam room, and you must do it with the proper disinfectant. Close all the lids on biohazard containers, and if it's full, you need to replace it. Then there's interviewing a patient. This is completed when we take a patient's health history. It's broken down into 6 categories: the chief complaint, the present illness, the past medical history, the family medical history, the social history, and the review of systems. A chief complaint is the reason for the patient's main visit. It's essentially why they're there. The present illness contains details and descriptions of the symptoms that the patient is experiencing, such as the onset, the duration, and the intensity of each symptom. The past medical history is part of the history that includes all diseases and medical problems the patient has experienced from the past. Family medical history is a record of health problems of the patient's blood relations, such as mothers, fathers, brothers, sisters, grandparents, aunts, and uncles, as all related by birth or blood. The social history will include lifestyle patterns that could affect the health status of the patient, such as smoking, drinking, recreational drugs, occupation, marital status, sexual preference, diet, exercise, and sleep habits. Now, a review of the system is typically done by the provider himself, and a physician will use different methods to examine and inspect the patient. Those 6 methods are called inspection, palpation, percussion, escalation, menstruation, and manipulation. So that is chapter 36 kind of in a nutshell for us. We're going to move on to chapter 42, which is discussing assisting with minor surgeries. So in some family practice offices, you as the medical assistant may assist with certain medical procedures done in the office. You could be responsible for cleansing a wound, applying surgical or suturing up wounds, applying a sterile dressing, and bandaging wounds. When cleansing a wound must be cleaned before any sterile dressing can be applied. That way you don't leave any debris behind that could cause an infection. Use warm soap and water to cleanse the area and remove the surface from any dirt or debris. And always clean at least 1 inch beyond the edge of a dressing that is to be applied. Again, so that way we're not contaminating the wound area. When suturing wounds, this is where you will use a thread to sew together body tissue. Sutures are made of non-absorbable materials such as silk, cotton, linen, wire, nylon, or polyester fibers. But along with those procedures, the doctor may perform some minor surgical procedures in the office. You need to be aware of all of these because you could be a part of them, such as electrosurgery, laser surgery, colposcopies, endoscopies, any cryosurgery, endometrial biopsies, incision and draining, and removing any foreign bodies or growths. You can review each of those procedures in your chapter for this week and in the page readings that you are required to read. We're going to move to chapter 48, which is focused on hematology. With the few pages that you're required to read, it focuses on the blood tests that are typically ordered in family practice, such as a lipid panel, a liver panel, a complete blood count or a CBC, and coagulation studies. A lipid panel will consist of a cholesterol, triglycerides, an HDL, and an LDL. This can be helpful when diagnosing patients with certain cholesterol diseases. A liver panel will consist of an ATL, an ALP, AST, and a GGT. These can be helpful when diagnosing patients with hepatitis. A CBC will consist of a microhematocrit, a hemoglobin, a white blood cell and a red blood cell count, and a platelet count. And lastly, coagulation studies will look at how well a patient's blood clots. Now your textbook tables 48.2 and 48.3 are great study guides for you guys. One will explain the common lab tests, and as you can see here, this one will explain the normal values as shown for blood chemistry testing. This will be something that I would highly encourage you to know, as it will come into play later in your fields of study. And we're going to wrap up this video here with chapter 57, which is discussing nutrition. Now, nutrition includes all the processes involved for using food for growth, repair, and maintenance. The nutrition process includes ingestion, digestion, absorption, and metabolism. Now, the standard American diet is said to contain too much fat, too many cholesterols, too much cholesterol, too much salt, not enough fiber, and insufficient complex carbohydrates. The best diet is a well-balanced diet and coming up with a correct eating plan with correct portions and major nutrients. As a medical assistant working within the nutritional field, it's important that the roles of nutritional professionals be followed, because you may be responsible for enforcing the plans that they have put forth for patients, or explaining to patients what those plans are. So you'll be responsible for providing the patient education and materials on the nutritional plan, assisting in research and creating patient education programs and materials as related to nutrition, completing referrals and pre-authorizations with the health insurance policies, and you want to also support and encourage the patients as they embark on dietary changes and promote the importance of following through with appointments. This is something, working in family practice myself for about 10 years now, we have to tell patients all the time that they may need to change their diet. Maybe it's because they just got diagnosed with high blood pressure, or they just got diagnosed with diabetes, or maybe they have high cholesterol, and the doctor wants them to be on a specific diet to help them better manage those diseases. So as part of family practice, that is something that you could do, not just if you're working in nutrition, although we may send a patient to nutrition for more of a clear plan. You can always start that plan at family medicine. All right, guys, that's all I have for all of our chapters this week. Again, those were chapters 35, 36, 42, 48, and 57. I will always suggest in every video that you read those suggested chapter pages, because it will really help with your discussion boards, your case studies, but as well it will help with your lab classes for the week. So for homework this week, you do have one discussion board. That one discussion board is on titrating medications. So you have a scenario that is given to you based on what the provider has ordered for a patient taking prednisone. And he's given a specific schedule for the medication. What you will need to do is explain why the provider would write a prescription in the manner that he did, and what is the term used for this type of dosing. So you'll have to read through the discussion board in order to understand that. Beyond that, it also says the provider gives you an order, and you need to understand what the word titrating means and what the provider is really asking you to do in that situation. Now, please remember that your discussion boards are to be written in APA format. That means that it should have a reference page, and you should be using in-text citations. You will also need to complete your initial discussion board no later than Tuesday, July 11th by midnight, and you'll need to reply to at least one classmate no later than Saturday, July 15th by midnight. I would also suggest that you go over to your Module 2 course folder and look at the rubric for the discussion board so you know how I will be grading you when it comes to it in the end, okay? You also have a case study this week, which is talking about community measures and healthcare quality. What you'll have is a situation where you will need to write a paper based on the scenario that you were given in your case study. What you will need to do is answer the 5 questions that are there in the case study themselves. But again, remember, you're writing this in APA format. So for your written case study, that means that you will have a cover page, a reference page, an in-text citations, all of it that you would normally need. And if you need help with APA format, please make sure that you're reaching out to me so I can help you. You can reach out to me via course messaging in Blackboard, or you can give me a call at my direct Rockford campus number, which you can find on your course homepage in the top right-hand corner next to my picture that you see there. All right, guys, have a great week too, and I can't wait to see your discussion boards and your case studies come in. Bye, guys.